Hello. So my name's Anne Horne. I'm one of the Kinship Consultants at Core and Bath, and this is my colleague.
I'm Claire Seth, the other Kinship Consultant at Core and Bath.
And we're here today to have a chat about a book that we're writing on supporting kinship families. And we're doing it this week because it's Kinship Care Week, and as part of Core and Bath's contribution to raising awareness for Kinship Care Week, we have produced a few written materials on our website, and we're having this conversation today to talk about a book that Claire and I are writing together. So Claire, do you want to just tell us a little bit about the book?
So we know that there's a lot of information out there about support for kinship carers and about the needs of kinship carers. And we wanted to write a good practice guide that thinks about the support for kinship carers from the social work perspective. So obviously we will be considering the needs of kinship carers that we know and hear about, and thankfully getting much more traction in the media and with the government at the moment. But this is a book that's been a while in the making, in the writing, I should say. It's a collaborative book with our predecessor, Dr. Louise Sims, and we're also working alongside organisations such as Families in Harmony, who are an organisation that is run by and supporting Black kinship carers. So the book really is to highlight what we think are the key principles and areas for social workers when they're thinking about support for kinship families. So we're hoping that the book will be published within the next year. It's very much a work in progress, and we're constantly revising when we think about new developments in the government. But we thought we'd take this opportunity today just to have a think about a couple of the key principles that we believe should underline kinship support and kinship support for kinship carers. So Anne, would you like to tell us a little bit about one of those principles?
Yeah, sure. So I've written a chapter, it's in draft form at the moment, about what we consider to be the key principles that we think need to underpin support to kinship families. And one of them that we feel really strongly about is strength-based practice. So I think it's about thinking how professionals need to value kinship care, working from a strengths-based perspective, and thinking about all that kinship care can offer children as a place to live when needed. Strength-based approaches approach things not from a deficit model, but very much kind of identifying strengths such as personal resources and resilience, or family connections, social and community networks. It also recognises vulnerability and need, but it very much focuses on the strengths and positives within a situation, because it's based on a belief that individuals can grow and change when provided with support, when provided with the right support. So I think when we think about kinship care from a strength-based perspective, then we can kind of really focus and think about what it means for a child to have the opportunity to live with somebody that they will likely already know, that they will probably already love and trust. And when we think about some of the other strengths of kinship care that research tells us, about outcomes and lower disruption rates, and children being able to have a kind of full and sort of positive sense of their identity, when we go into thinking about how to support carers with that kind of strength-based lens, then I think it's a good starting point to think about, therefore, what support carers might need to be able to kind of do the caring role even better.
Certainly, I mean, one of the things that we've talked about at Core and Bath is a new assessment format that would hopefully, again, pick up on that key principle of strength-based support and strength-based practice. So that's another one of the projects that we have in the pipeline, is the revision of the Form C. So when we're thinking then about support, particularly for kinship carers, why is it important that it comes from a strength-based perspective? We understand why it's really helpful to think about assessment from a strengths-based perspective, because you're thinking about everything that the kinship family can bring and the pre-existing relationship that they're most likely to have with the child. But can you just talk a little bit about support particularly?
Yeah, so I think when we think about support, we also need to keep thinking about assessment of support needs. So, when we think about a support model, it needs to be kind of assessment, planning that support, providing that support, and then reviewing that support. So if we think if an assessment of support needs is the starting point, then the strengths-based practice needs to come in from that very beginning. So that obviously if you're going into a family, they're describing to you perhaps some challenges that they're facing, and so then you would be kind of exploring with them what some of those challenges might be. And then from a strength-based perspective, rather than thinking from a kind of deficit model of, okay, they clearly don't understand therapeutic parenting and they're kind of relying on perhaps a kind of reward and punishment type, more traditional style of parenting, the strengths-based approach might kind of encourage you to think perhaps differently and think, okay, so they're doing this well and they're doing this well, their relationship with the child is strong, there's a positive kind of bond or attachment, they can mentalize the child's kind of feelings well, kind of put themselves in the child's shoes, but then they kind of get a bit stuck and don't think about another parenting approach. So then a kind of from a strength-based perspective, you would then be trying to articulate, well, what support could be provided here to enhance their kind of caring even further. So then you might think about, for example, a therapeutic parenting intervention or signposting them to a support group.
And I think from my practice perspective, that what we know and what we hear from our members is that kinship arrangements often start from a point of crisis, and actually being able to think about therapeutic parenting, especially at the start of when a child comes to live with a family, might be beyond possibility at that moment in time, and that's something that you can talk about and develop as time progresses. And I suppose that then leads us neatly on to thinking about another one of our really strongly held key principles, which is about the value of relationship-based practice.
Yeah, so I mean, relationship-based practice it's also known as relational practice or connected practice. And I guess it's about prioritizing the relationships that we develop as social workers with the families that we're working with. So relationships, in many ways have always been at the heart of social work practice. But I think it's easy, or the focus on relationships is vulnerable to being lost sometimes in the kind of competing priorities of social work processes and tasks and forms to be completed and case notes to be recorded, and actually allowing ourselves to kind of pause and reflect on, the need for us to have kind of mindful, kind of authentic relationships with the families that we're working with, arguably kind of provide for the most likely opportunity for change. So if a family feels kind of heard and seen and understood, respected, trusted by the social worker, understandably, we're all humans, we can imagine that that's much more likely to kind of have a positive impact. And it's any kind of messages of sort of advice or support are more likely to be received well, essentially, by family members. And it's more of an authentic experience where you're bringing yourself into that interaction with the family to genuinely be alongside them at a time of often crisis and stress and emotional challenge, really.
And I think just allowing people to, as you say, be genuine in their emotions and to feel safe in being able to express anger, frustration, feelings of maybe not being able to manage, and really questioning whether they are the right people to look after the child, and having that trusting relationship with the social worker. But that does take up time to build those relationships, and it's I suppose it's about managers and social workers recognizing the importance of allowing those relationships to develop, which, as we know, can be incredibly difficult when you're under pressure of short timescales. But it is, we're thinking about support above and beyond that assessment period, where hopefully you will have time to develop those relationships more. Okay, thank you. So that's just a couple of the key principles that we will be exploring in a lot more depth in the Good Practice Guide. We'll also be having a much more of a think about the regulatory and legal framework. We're waiting for the publication of the National Kinship Care Strategy by the government. So that will obviously have an impact on our good practice guide and the areas for consideration. But we do know that we will be thinking in much more detail about some of those more practical areas, such as health and education, housing, finance, family time, therapeutic support for both carers and children, which, as we've said, we feel these are the key elements of good practice for kinship care support. And we hope that the book will be out before too long. So we will keep the website updated. So keep checking it out when you can.
Thanks, Claire.